Just still missed her in one of the training lectures.
Alright.
Left back up.
Good evening, everybody. Today I'm going to give you a demonstration speech over CPR. So, let's say you're at work and all of a sudden your coworker falls on the ground and is unconscious, not breathing, no pulse. What do you do? Would you know what to do? Probably not. So every year in America, roughly 350,000 people fall victim to cardiac arrest. 90% of them do not make it. So today I'm going to walk through the steps of CPR. That way, if you're ever in this situation and your coworker falls out, you might be able to double or triple their chance of surviving. Okay, so for today I have Rescue Randy and a practice AED to walk through the steps on how to properly administer CPR. So first step, your buddy falls out. If you didn't see what happened, you want to make sure the scene's safe. Tap him, hey buddy, you alright? You alright? If nothing, check for breathing, check for pulse. So you want to feel on the side of their neck for a pulse. Check for 5 to 10 seconds, no longer than 10 seconds. If you don't feel anything, you want to start CPR immediately. So first step is starting compression. With compressions, you want to lock your fingers like this. Okay. Put the palm, the heel of your hand, center of the chest, like this. Put your body directly over theirs, and start giving compressions. Right. So it's 30 compressions, and then 2 breaths. So for the breaths, you want to pinch the nose, head tilt, chin lifts. You want to grab their chin on the bony part of their jaw, pinch the nose, and lift their head back so you open up the airway. You know, breath, give them a breath, and then you're going to make sure that chest rises and falls. So breath, rise and fall, and then breath, rise and fall. As soon as you get the 2 breaths, you want to roll right back into compressions, right? So 30 compressions, you're going to keep doing that. So compressions, 30, 2 breaths, back into compressions. You're going to do this 5 cycles. Once you're done with your 5th cycle, you want to reassess the situation. Are they breathing? Do they have a pulse? Are they still the same? Whatever have you. So if there is an AED available, you want to get the AED as soon as possible. So for the AED, all you want to do is get the pads, right? And so 1 pad will go on the upper left side of the chest. The 2nd pad will go on the lower left side of the chest. Okay, so as soon as you get an AED, you want to turn it on, follow the prompts. Most AEDs nowadays will tell you exactly how to put the AED together and when to shock, when to do CPR. So it'll walk you through it. Also, one thing I didn't cover at the beginning, you want to call 911. Most people have a speakerphone. Call 911 on speakerphone and start going through the steps while you're talking to the dispatcher. So turn on the AED. It's going to tell you, walk through the prompts, put the pads on. If it detects a pulse, it'll advise a shock. It'll say clear the patient. So for clear the patient, you want to make sure no one's touching the patient, so the shock goes to them and doesn't go through them into someone else. Clear, make sure no one's touching it. Hit the button, and it's going to say continue CPR. So at that point, you're going to go right back into compressions, right? So interlock your fingers. 30 compressions, 2 breaths, 5 cycles. So you'll keep doing this until more advanced help arrives. EMTs, ambulance, whoever is more advanced than you at this point, they'll come on scene and they'll take over. That's really all I have. Does anybody have any questions? Yes.
What do you do if you tilt the head and there's something inside the body that you can do
asked is if you tilt the head back, you look inside the mouth, and there's something in there. So if you choke, if you do see it, you can put your finger and try and get it out. If you can't see it, but you think there might be something in there, don't see it, don't try blind finger sweep. So if you do see something, get it out and keep going through the steps of CPR. Good question. Any more questions? Yes.
This is a two-part question. So one, what if the person has like a lot of chest hair? And
Okay.
two, like what if it's like an infant with a really small body? Like where do you place all the pieces? Is it
Okay,
different or is
so-
it the same?
Good question.
So
Thank you.
chest hair. So a lot of AEDs will actually come with 2 sets of pads, and some of the more Gucci AEDs will come with a razor. So if you come on someone that's really hairy, when you put the pads on, they need to take their shirt off, right? So it needs to be skin pad. They do have a lot of hair. If you don't have a razor, put the pads on, stick them on firmly, and the AED will tell you whether it's detecting a pulse or not. If it says no, then rip the pad off. The adhesive should pull a lot of hair off. If this is your only pad, try and stick it back on so that hair will lay down at that point. If you have 2 pads, just rip that one off, put the new one on, and you should be good to go. If you have a razor, you know they're hairy. You know, try and get some of that hair off real quick. That way you're not wasting time. So for the baby question, does that answer your question with the hair?
Yeah. It
Okay.
is.
So for the baby, if they're really small, you can put a. So I don't have a baby dummy. However, you'll put one pad on the front of the chest here. And if they're too small to where you don't want to overlap the pads, so if it's too small where you can't fit both on the front, you just put one on the center of the back. All right. Go from there. Unless you have pediatric pads, which normally those are a little bit smaller, probably half this size, so they'll fit. But in this case, you may not have that. So, anybody else have any questions? Yes.
You've used the acronym AED like 15 times already. What does it stand for? And what does it actually do?
Automated external defibrillator. So basically, cardiac arrest. The condition of having cardiac arrest is an electrical issue. So your heart it makes a pulse, right? So there's an electrical pulse going through your body, essentially. So if you go into cardiac arrest, this pulse is out of whack. It's not working properly, and so your heart doesn't know really what it's supposed to do. The AED is gonna, when it shocks, it's gonna reset and try and get the heart back on its normal rhythm, where it starts getting that blood flow to the major organs, brain, all the other organs here. So, does that answer your question?
Yep.
On AED?
Yep.
Cool. You guys have any questions? All right, let's conclude. You got one.
Yeah, I got one. So, can anyone just do this stuff? Like, are they legally covered? Anyone?
So if you have to do it, it's their life, right? So if you want to let somebody sit there and die, that's on you. If you know how to do this, I mean, it's advice to do it. If they're conscious and they go out like they're choking, in that case, you want to ask permission. You don't want to just go up behind somebody and start giving them, the Heimlich or the abdominal thrust right off the bat. You want to ask them, are you choking? Do you need help? Can I help you? If they say no, get ready for them to pass out. If they don't cough it up, and go from there. If they're passed out, not saying no is kind of consent, good Samaritan. So, cool. All right, that concludes my speech. Thank you.
See ya.